It's the summer season, so we're talking about allergies from pollen to insects to food allergies. Ann Ames, a nurse practitioner with Cone Health Allergy and Asthma Center of North Carolina, is here to talk to us about how to prevent and ease some of the symptoms so we can all enjoy the summer activities. We really want to be there. All right, let's first start with this. Let's start with the allergies that are related to pollen. I know I feel it, whether it's grass or weeds or tree, whatever it is. It causes the itchy eyes, the scratchy throats, and all that kind of stuff. How long does this last? All summer long?
So that is the question all my patients with pollen allergies have been asking me over the last several months. And the answer is it just depends on what you're allergic to. Tree pollen season starts in early February and can last for several months. Think pollen apocalypse, where everything is just covered in pollen, and you can even see those pollen particles floating in the air. Thankfully, that is starting to pass at this time. But if you have allergies to grass pollen or weed pollen, hang on because these pollens thrive over the summertime and can last into early fall. Think August or September. We tend to spend more time outside over the summertime, so our allergies can worsen. And the answer is it just really depends on what you're allergic to.
I love the pollen apocalypse. That's super funny. Okay. And also super sad, right? For all of us who are dealing with it. So, what should we know about the over the counter antihistamines that we take for relief?
Oh, exactly. So we live in a time where we have many choices for excellent over the counter allergy medicines. If you've been to the allergy section, the allergy medication section at your pharmacy, you know there are so many choices that finding the right medicine for you can seem overwhelming. So I just want to take a few minutes to talk about medicine basics. We'll start with antihistamines like Zyrtec, Xyzal, Allegra, and Claritin. These medications decrease nasal, like runny nose and itch. They generally start out working very well and they can lose their potency just over time. So, we suggest that patients change these antihistamines every several months or if they start experiencing symptoms. There is a nasal spray that's an antihistamine. It's called Astapro, and this targets nasal passages, and you kind of skip the unwanted side effects like sleepiness, or dry mouth. And then moving on to nasal congestion, we suggest a nasal spray like Flonase, Nasacort, or Nasonex. And these are best used daily during pollen season when you're experiencing symptoms. And don't forget those nasal saline rinses. They're a nice non medicated choice to really rinse those pollens and pollution out of your nose. You can generally double these medications when you're feeling symptoms. However, you take the risk of experiencing more side effects. So, this would really be a temporary option.
Can you take that Astapro and the Flonase at the same time, like during the day? Just space them
You
out a
sure
little bit?
you sure can. A lot of people have a stuffy nose and a runny nose. It doesn't really seem fair, but if you use both of these medications, it will treat those both of those symptoms.
Okay. All right. So, in addition, I know that we've been told we should wear like a mask when we do yard work. We need to take our shoes off when we come inside to, keep the pollen down, that kind of stuff. Anything else that we should put in our daily routine to help with that?
So we all want to avoid those pollens as much as possible. So some general tips include wearing sunglasses to keep the pollen away from your eyes and your eyelashes. There are wraparound sunglasses also as an option, especially if you're going to be doing any yard work or mowing the lawn. Washing your hands with soap and water before you touch your face is very important. The sanitizing gels are great for germs, but they don't remove pollens or allergens from your hands. And then be sure to shower when you come in from outside for the day. This decreases the amount of pollen that actually gets moved around in your home. And then be sure to keep those HVAC filters up to date and change the filters as recommended. And we all love those bright, sunshiny days, but when the pollen is high, keep those windows and doors closed. And similarly, when we're driving, keep those windows up. And while you're out and about, remember that the pollen levels are highest between 10 a.m. and 4 p.m. So if you need to be outside, try to run errands and get everything finished early in the morning or later in the evening.
Okay.
So
I had
practicing,
no idea that the hand sanitizer didn't take off the pollen. It takes off bacteria, but not pollen. That is a good point. All
that's
right, we're
right.
going to continue to talk about all of these summertime allergies. We'll be back in just a few moments.